So this is a typical setup. A patient would be on this end and a physician or whoever is on the other end of the event would be within their office, whatever site that may be, and it can be at any site. We link a lot with Ottawa, and so a patient would sit here and have direct communication with the physician on the other end.
Sue, where are you right now? Where's your office?
I'm at home.
Oh.
I work from home.
Yeah, nice. Yeah.
So maybe I can tell you just a little bit about the Champlain region in general, of which Winchester is a part of. I've managed this region now for, I guess, about 6 years now. We are an incredibly robust region in terms of the clinical activity that we do by telemedicine. Last year we reached over 30,000 clinical events. And as you probably know, Champlain LHIN stretches from Deep River to Hawkesbury. So our main consultant hubs do come mostly from the Ottawa area. So the Ottawa Hospital is a big part of that. CHEO, Queensway, Carleton, the Mulfort. But we also have some private physicians that actually do work directly from their office as well. And we have everything from pre-anesthetic clinics. Oncology is starting to move, where we need a little bit more movement in that world, but the Ottawa Hospital is really looking to ensure that oncology patients have to travel less and less for appointments and just be there for the ones they really need, like chemo and radiation. We have pain clinics. We have endocrinology clinics, we have nephrology clinics, just about every specialty that you can possibly think of can be provided in this manner. And part of what my job is to work with sites like Winchester to sort of figure out what their need is and where their service gaps are, and then try to go and hunt of where that consultant service might be offered from. And then I also work on the other end of the equation, where I work with the consultant hospitals when they have a physician that wants to drive out care, and ensuring that the different patient sites that they may want to connect with are prepared and ready to go. So these units sit on a secure and encrypted network. So although it may look like Skype, it is not. So there are specialized circuits that the hospitals, the family health teams, and the CHCs all have, and they're dedicated ports that run through VPN tunnels to ensure. So again, as a provider, actually as part of PHIPA, as are all the hospitals, the family health teams, anybody that is involved in healthcare as part of the Privacy Act of Ontario, and we have to ensure that patient's privacy is going to be maintained during a clinical event.